Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody.
Hello.
Welcome to another show. We have our people here. Colleen, our producer. We got Freddy from amp2.tv.
Good morning.
And we've got a new person here, Sarah, who's watching our computer. And we've got the most important person. Oh, that's not me. I'm Les. The most important person sitting right here,
No,
Dr. Pannozzo.
You're more.
Oh, yeah, I'm more than Les. You're right. I like that. How you doing, Doc?
I'm good.
Well, you know, it's very funny. We've been doing this for a long time, and everyone's listening to us and saying, oh, how could this be true? Well, remember, I think 6 months ago, we talked about yoga?
Yes.
And you said that yoga could do a lot of pain, right?
A lot of trouble. We get a lot of new patients from yoga.
Right.
Yeah.
Well, you want to hear something funny, Doc? There was a big article, and people, if you want to find out about risks of doing yoga, you could go to yoga and risk. And here's what they said, Doc. A herniated disc. A lot of people could get a herniated disc from an osteoporosis from doing yoga. Is that possible?
I don't know what they mean by that. First of all, you can't get a herniated disc. I don't even know what that means.
Right.
These are ligament sprains is what they are.
Okay.
And they're because of the abnormal posture that people put themselves in yoga. So you have to really be careful. The body is designed to do certain things.
Right.
But when you see these abnormal things that in yoga and they hold it for a while, I mean, it's you just can't do that. It's impossible.
Well, it was very funny. Part of the article was written by a gentleman who's been doing yoga for almost 30 years. And he said that a lot of, he has to evaluate some of the positions that these people are in.
Is he a teacher of yoga?
Been a teacher for 30 years.
He's a teacher of yoga. Okay.
Yeah. Who I would guess 30 years. Did you ever see yoga people? They're like 9 pounds. They don't have any muscle tone.
Yoga people?
Yeah, and they look like they haven't had a meal in 6 weeks. Right. Okay. Those are the yoga people that I've
But
seen.
be careful because there are football players that are yoga people.
Well, now all you football players that heard that, I think yoga is very good for you.
They're going to come in here and make you look like a string bean.
Okay. Now here's what else they said. The bell is because we don't want to make the football players mad at me.
He doesn't want to get chased.
And one of the things that they said, which he stopped doing, is when he made them go on that headstand position. He said he found out over the years that a lot of these people that went on that standing on the head caused damage to the vertebrae. So I'm here to ask you, is that possible?
Yes, indeed.
Okay.
Absolutely.
Why? I mean, I know standing on your head isn't a good thing to do, but
It's not a normal position to be in. Your body is only made to do certain things, and they're making it do other things, and that's how an injury occurs.
Okay. Well,
Does it make your head flat?
no. Does it make it grow hair?
Let's see. Well,
No, I don't think so. Hey, Doc, what about when they hang you upside down on that bar from your ankle so the pressure is relieved from the spine?
That only helps one person, and that's the guy who made it.
Oh, what was the guy that made that? He has people hanging from a bar to straighten their vertebrae?
Yeah.
That's the one he's talking about.
Yeah, what was that guy's
The
name?
bat bar. I don't know his name.
He always comes out, this guy with gray hair, and he says, I had back problems my whole life, and he sits there with these feet. I would get dizzy.
Well, there's more
Easier.
to it.
Yeah.
There's more to it than what they're letting you know. This is the whole thing.
Right.
You're only getting part of the question when you listen to people. What about that laser surgery? You remember that?
Oh, you put a
They
little
use an
laser in your
MRI
back?
Yeah, they use an MRI to diagnose your problem. You can't use an MRI to diagnose your problem. because it's done laying down, and back pain is vertical. You have to be upright to find it. And you have to know more than what an MRI tells you. So that's why those are failures a lot of times.
Is that light laser or hot laser? Because there's a difference. A hot laser will go inside your skin and burn a hole in your bone.
Well, it's that's just a term they use. Laser surgery. It doesn't mean anything.
Light laser doesn't do
A
anything.
laser is a infrared
That's a cold laser, yes.
phenomenon.
Do you
And,
know, Doc, I know a guy that makes a living doing that.
Doing
Millions. Guy's a millionaire.
what? Doing
And
what?
I don't know. He does this thing with the laser, and the machine makes a lot of noise. People leave, and they go, oh, my God, I feel relieved.
The thing about it is, it doesn't go past the skin.
It doesn't.
It's not. It doesn't go past skin, and the problem is usually. Well, what if you're a 300-pound person, and you have a low back pain? You know where that is? It's like 6 inches under the skin. You can't even get to it.
I know. The laser
That's why
wouldn't help.
massage doesn't work, manipulation doesn't work, physical therapy doesn't work. All of those deny where the problem actually occurs, and you have to know that before your treatments are going to be any good.
So, Doc, so when somebody cracks your
You know,
neck.
Doc, you're doing my whole show now. I was up at 5 o'clock in the morning, and you're
sorry.
answering all my questions.
Hold on,
I've been
hold on a
asking.
second. So you go to a chiropractor, and he cracks your neck.
Oh, well, that's another thing I got to talk
And he cracks your shoulder, and he cracks your back. What the hell's he doing?
Nothing.
I mean, he's
In
just
fact,
cracking you all over the place.
He's hurting you, actually. Any crack you get is an injury. It's the same thing as.
Guess you guys don't really need me, do you?
Yeah.
Wait a minute, Les. These are questions that we got to get out
But
there.
there's one thing that you could talk about. And
What?
that's my book. You know, I reread my book.
Right?
That
Rewrote.
I published. I didn't rewrite it yet.
No.
I
Oh, you reread it.
it.
Well,
And you know, that's a damn good book. I
Yeah.
think people should read that.
well, Tom,
Well,
how
how do you get it?
How do we get
basic-
that book, Doc?
The basic stuff has not changed. Now, what has changed is the research after that. But that's technical stuff. You don't want to know that anyway.
No, how do we get that book, Freddy? Tell them how to get
On
that book.
Pannozzo.tv, you go to the store button and you click on there, and you can buy it right from Amazon.
Yep. You get it from Amazon, and I would. In fact, I think I'm going to get a bunch of them and sell them through the office because.
I think we should have a book signing, Doc.
Yeah,
Again?
yeah.
Yeah. I
Yeah.
think we should do a book
That's a
signing.
great idea. We'll schedule a day.
And we'll have a naked model so we can show her how
No,
that
we
works.
can't get a naked model.
That'll bring everybody in.
Forget about it. With a glass of wine, you'll be set.
No, you can't do that. We'll all be in jail together, and I don't want to be next to you, Freddie.
It's a medical
look at it
thing.
this
Can't wait to
way,
hear what
it's
they got me into a naked woman to look at their body. Come on.
I think.
Okay, Les, we'll give you a naked man. Make
Okay.
you happy.
I won't get in trouble.
It costs $20 for the book, I think.
Well worth it.
Through Amazon.
Yeah.
But look at it this way: if you go to Five Guys for a hamburger, it's $8, which you demolish in a matter of 5 minutes. But this book you're going to have forever, unless you burn it.
And the
You might wanna
hamburger
do
is
that.
gonna hurt you.
Yeah. So I mean, it's well worth it. But those are secrets in there that you don't get ordinarily.
Well, I mean, you know, a lot of people, I guess, listen to us, and the beauty of it is that I'm not saying, I shouldn't say this the way I'm going to say it, so I'm not going to say it. The people that listen and understand what you do, you've noticed a very big increase in the number of people that are coming in to see you now.
Oh, it's just a lot of people.
I mean, and this is just new people that have never had.
I'm curious.
Go ahead.
Anything they've asked you out of the ordinary? You got that one strange story?
He's got strange people that have called him up on the phone and asked him what he does, how he does it. You can't diagnose on the phone.
Yeah, we just had an incident. People call me up. Well, what do you do? I had all the shots. They think they had everything. You know, they've been told they had everything, but that is not true. What we do is entirely different than what anybody else does.
And they know that. That's why they called you.
And they're probably calling to get the answers, right? They want to
Well,
get some
it's
kind
funny.
of answer over the. And I say, well, make an appointment, and I'll tell you what I could do.
If I put my finger here, it hurts. So what are you going to tell me? Don't put your finger there, right?
No, and that's that old joke. The guy says, Doc, when I put my hand up, I have pain on my hand and under my. He said, don't put your hand up.
That's right.
I got two comedians here today.
No, if they call in and say, what do you do? Well, what do you got?
Yeah,
I got pain. Well, bring it down. I'll tell you what I do.
That's precisely the point. You can't have anybody tell you anything over the phone. That is unethical, and people go to jail for that. I mean, you don't want information over the phone. First of all, they don't know what your problem is. You
Cause
have
and
to
effect.
examine cause and effect. And you need a diagnosis first. That's why a lot of treatments don't work. The diagnosis isn't there. I mean, if you had shots and they didn't work, what does that tell you about the doctor who did them?
He put it in the
doesn't
wrong
know what he's
place.
doing. That's what it
Right.
tells you.
Yeah.
Not that you had everything. You didn't have everything.
If they didn't see you, they haven't had everything.
That's right. We have the ultimate, and we have virtually 100% cure rate.
Well, we had a lady at one of the places where Linda works, and she says, "Well, I got a cortisone shot to fix it, but the pain came back."
Yeah.
And so I've had shots, referring that you're going to give her a cortisone shot. So Linda says, first of all, that's not good for you, and second of all, that's not what he does. So they're making assumptions that a shot is a shot is a shot.
That's true.
Because they're getting, it's like, it's very funny. Everyone has an opinion. I mean, everyone say, don't go to this doctor, see my doctor because he's the best doctor in the world. The only doctor that's the best doctor in the world that cures you, then he's the best doctor in the world. I mean, you could take.
That's true.
I was talking to my dermatologist, and I was talking to him about the Botox in the head for migraines. He looked at me. You know what he said to me? It doesn't work. It doesn't work, and they're paying a lot of money.
But everybody knows it doesn't work, but people keep going in there in droves.
I don't think everyone knows.
I don't know. What do you know about droves?
I went down. They do the Botox treatment down on Palmetto. There's a mall in there, and there's a place that does it. And the line goes around the corner.
Well, it might be Botox for wrinkles.
Oh, okay.
See, the idea of Botox when it first came out is to get the forehead that has a thing to give you a shot. But what happens is if you go to somebody, I went and had it done, and I slept with my eyes open. My wife was scared to death. I was sleeping with my eyes open because they hit the wrong nerve. Imagine sitting next to a guy like this with his eyes like that.
Can you imagine that? This is a horror show.
I would have hit it with a pillow.
This is Les's horror show. This is what this is.
So you're telling me wrinkles give you migraine?
Yeah,
No.
just be careful, people.
I mean, you gotta watch out.
Don't do that. Migraine has a specific location, and we know where that is because we did the research work on it, and we take that out in one day. So Botox is not what you want at all.
Well, not only that, no one guarantees. They say it might relieve the pain like an aspirin would, but it doesn't get rid of the symptom, and you actually get rid of the migraine headache forever
We get rid of the source
of the pain.
of it.
So anyone who does it, who
Same
seems a
thing
little
with the lower
skeptical.
back. Those are complicated areas. People think it's simple. It's not simple.
Right.
You have the physiology of pain production, which is described in my book. It's how you have to know the anatomy and what the anatomy is supposed to do, and why didn't it do it. That tells you why you have a pain and where it is. Pain patterns are important. Just like what Leah was talking about.
Yeah.
Her ankle pain was not from her ankle.
No.
It was referred there from somewhere else. But if you don't know that, you can't treat it. And this is all we do for 52 years. 52 years.
52 years. What you said is true. I mean, you looked at Leah walking and you knew right away it wasn't the ankle. Now, she would have had to go for shots in the ankle.
Yeah, the ankle was normal. You could
Right.
see it.
So, that's the beauty of what you do. I mean, when I
Well,
send people
you have to
over-
be a good observer, and you have to be know what questions to ask. When we take a history, for instance, it's all based on the structure involved. Now, bending forward involves certain structures, and you have to know what those are. So, if you have a pain bending over, that means it's certain things, and then you have to know which one it is, because there's 5 of them. And but that's the way it goes. So you really have to know what you're doing. You can't just go to someone and have your back treated. I mean, if that's all you think about yourself, I don't know what to tell you. I mean, it's much more significant than that. You have to go to someone who understands the anatomy, how it's used, that's physiology, and the failure to bear weight, which is where the pain is. So once you know that, then you can treat it. Otherwise, you can't.
Okay, folks, if you have a question for the doctor, you can call him up at 1-800-889-0267.
Oh, if you got a Botox story, I'd like to hear.
Oh, yeah, if you got a Botox story about going for migraines, please, 1-800-889-0267. If you don't believe what we talk about, you could go to Pannozzo, that's PANNOZZO.TV.
Correct.
And see people who have had scoliosis and see people who have had migraines and other ailments. Okay,
Now, Les, I got a story to share with him.
go ahead.
The Mets, I'm a big Met fan. Their catcher fractured the pinky from a pitch. He got hit in the hand, and they fractured the pinky. So he was out for weeks. Okay, fracture, broke, whatever. Now he had a setback. The hand has become inflamed. They put him back to play again in a rehab assignment in the minors here in Port St. Lucie. So the hand now doesn't close. So now they have to give him anti-inflammatories. He's another 3 weeks off the shelf.
Yeah, well, they probably had him in a cast or something, and now he's got a wrist problem.
Caused by the cast.
Yeah, in disuse.
Question: he goes to see you. They remove the cast. Goes to see you before he goes into playing rehab and all that. Look at the hand. You see the inflammation. You take care of the deal. This doesn't happen.
What are they rehabbing? I mean, I hear that all the time. Do you understand
Strengthening the hand.
Do you understand what that means?
I understand that he does this
You
all
have
day.
to know why it's there in the first place.
He opens and closes his hand all day.
It's a diagnostic problem. It's probably the wrist, and that's not the way to find it.
Mm-hmm.
So he's out.
I mean, they talk about rehab. They don't have a clue what they're talking about. I'm a rehabilitationist. That's my training.
Right.
And you tell me you guys know how to rehab something? I mean, it's just nuts. I mean, it's just... That's why we have this radio show. I'm trying to straighten people's thinking out. I mean, it's for their own good. Hey, I don't have to work anymore. I retired two times already. It's not
Doc,
why we're here.
If you quit working, we have nothing to do on Sunday. We'll go to the beach and we'll get sunburned. We don't want that to happen.
We'll go to the malls and watch people
go to the mall and spend money.
You see everybody falling.
Well, you know what? We had mentioned many times. We have mentioned chiropractors. Now, again, this is not my opinion. This is not Dr. Pannozzo's opinion. This is opinion of other doctors who that you could research.
We've talked about the chiropractors a lot. Can
Okay,
you read a question?
You want to take some questions?
Yeah.
Oh, we got a lot of questions today. Okay, let me start with some of the. Let's start with the new ones, then we'll go back to the old ones. Okay. Albert, who wrote from Google Plus, writes this: I've been involved with sports for over 12 years, and all of my injuries have been treated with anti-inflammatory and rehab, with lots of rest. Loss of activity requires me to rehab to gain strength and mobility back. If your procedure is fast-acting and does not require rehab since time is lost and is limited, will the area you work on be as strong and productive as it was before the injury?
Absolutely, sure.
Okay.
There should be no reason not to.
Range of motion without pain is what the goal is.
Right.
So when you get examined, you find out what the range of motion is, mark that down, and where the pain is. Now, after the treatment, you should be able to do all that.
So if I'm an athlete, if I'm a baseball player, he's treated differently than a basketball player who's treated differently than a soccer player, right? Range of motion is different.
No.
Well, soccer player,
The
range of
body's the
motion
same
is bigger.
for everybody.
Yeah, but I have to be more flexible in certain sports. That's what I'm saying.
Well, but it's all diagnosed. It's
Yes, that's what
examined
I'm
for
saying.
those things, I mean, but a fall is a fall. You could be a basketball player and fall on the floor, or you could fall out in the field. You're going to have the same injury.
Same injury, but on a different body with a different outcome, is the way I would say it.
Okay. Well, everybody's an individual, and they're treated that way. Everybody examined for that particular problem they have.
There you go. Custom job, baby.
Yeah,
So when a
custom.
basketball player falls, there could be a good chance that he could, as he got older, get scoliosis.
Well, you have scoliosis, have low back pain or hip pain,
Right.
which we referred to the knee. I mean, you could have a lot of trouble
Right.
there. Between the shoulder blades, because as you hit, there's all kinds of places that could be injured, and you have to know about the physiology of weight bearing. You have to know this stuff, and it's the anatomy, how it's used, and what happens to it when it gets hurt. You have to know where it is.
So just for new people that are tuning in, Dr. Pannozzo is a graduate of Ohio State University as a medical doctor. So it took him about someone that has done this for almost half his life. And he has gotten better and better.
years.
52 years.
There goes my picture.
Okay.
And there you have it.
Okay, here we go. Our new lady, Sarah, and I messed up the sign. So I don't know if we'll be able to put it up during the break. I saw Freddy smile, but let's talk about more important things. Let me get another question here. Bruce from Survey Monkey writes, I'm a sports agent that has played at major professional level. One of them has seen your show and has asked me if you worked with athletes at this level.
Bring it to the mic.
If you've worked with these professional athletes at that level. They want to know because of their bodies being conditioned to a higher level if medicine used would affect any other medications the doctors put them on. I could even answer this question, but I'll let you.
But that's a good question.
Yes, it is.
If they're using medication and you come along, do they have to stop?
I don't know what kind of medication they could be on. I mean,
Well, they're playing for a team. What do you think?
I
I know, that's a tough one. This is not as easy as it sounds.
they don't get medication in my office.
No.
Exactly.
It's shots only, and it works.
No medication at all.
So
No
you don't
rehab,
have to,
no
You don't have
drugs.
to take anything by mouth.
No.
There's no reason to do it.
Okay. Okay, next question. Michelle from SurveyMonkey writes, my dentist informed me that inflammation can be a leading factor to heart attacks. Gums in the mouth inflamed can be early warning sign that bacteria and inflammation can be surrounding the heart. My question is, if you have inflammation throughout the body, hurting shoulders, ankles, hips, all from inflammation, will curing these areas make it safer for the heart?
Heart has nothing to do with it. It's very difficult to get an infection around the heart from the mouth.
Right.
I mean, I don't know what kind of bacteria you can have in there, but what's the best treatment for bacteria in the mouth, Les?
The best
Listerine.
thing is vinegar, and the best thing for cleaning your mouth is vodka.
Vodka it is. Kills everything.
No, I drink a lot of vodka.
Yeah.
Well,
swirl it around before you swallow
Well,
it.
there
It
you
kills
go.
all the
I
bacteria.
think we got another. Well, I think we got another Dr. Pannozzo on the air right now. Hold on, we'll speak to Paul. Hey, Paul.
Hey, good morning.
How you doing? Man, you always surprise us with a call when we're not expecting you. Say hello to your dad.
Hey, how you doing, Paul?
Hi, good morning. Yeah, it's about half past my usual time when I call in. But hey, I have a tea time here this morning with a couple people that I work with, and I wanted to comment about a lot of times when you golf, I've seen a couple people just this past week, 3 of them with the leg pain. These are older guys with leg pain, and you think it would be from the back or something, and it's where the hip muscle or the hamstring attached to the undersurface of the pelvis. Because their back tests normally, and they're really tender on that bone, and that hamstring origin. It's a great mimic of a irritated nerve in the back. So people call it sciatica. That term, but sometimes it's just a muscle there at the pelvis. Got to watch out for it.
So what do you think, Doc? Is
that's
he
good.
right?
Yeah, we see this quite often. That's the bone you sit on. So the history
Coccyx
there
bone,
would
right?
be,
Is that the coccyx bone they talk about?
No,
No.
it's ischial tuberosity is what it is.
Oh, okay. Holy God, you guys know all these legal
But yeah, we had 2 this week just like that.
Really?
Yeah.
So, whoa, wait a minute. It was a sciatica or was it a hammy?
Sciatica doesn't mean anything. It's a hammy.
A hammy. We talked about hammy.
Yeah, we talked about that last week.
I'm amazed about this. You know how many hamstring pulls I've had in my life?
Yeah. Well, you have to know how to diagnose these things. It could be anywhere in the femur also. You have to know how to do it. And then you got to put a shot in it because that cures it quick. So if you're an athlete, you don't want to be on the sidelines.
It's a great mimic of a typical of an S1 nerve root. And I've can be honest, I can say that I've done an injection in the back. Once or twice, if someone's got referred for that, and then you think, what, maybe that was the right thing to do. You see him next time, and we went after the spot at the origin, and that gave him the better benefit. But it happens. It happens a lot.
I got a question for your son.
Okay.
Ricky Henderson, Hall of Famer, all-time base stealer, was on the shelf. No, let him hold.
Okay, we're gonna
Was on the shelf
tell the whole caller
for
to
a
hold.
long time because he had bad hammies. If he knew you in that time, in the 80s, could you have resolved that issue for him?
Yeah.
Well, while you're there, Fred, we got another caller. We both you guys on at the same time. Hold on, we got another caller. Hi there, you're here with the Dr. Pannozzo from here and the Dr. Pannozzo from Arizona. What's your questions?
Am I on?
Yes, you are.
Okay, this is Tony Jingo, Dr. Pannozzo.
I'm sorry?
Tony Jingle.
Okay.
Tony Jingo. Bingo with a G.
Yeah, he's a doctor.
Anyway, I just was wondering, I came north 4 days ago, and I was wondering if you have anybody you could refer me to up here in the Cleveland area.
Cleveland. Arizona.
I don't.
Cleveland, Ohio.
Yes.
Well, there's only 2 people in the world that do it, so she would
Yeah,
call.
what we do is pretty much in-house, and I don't know of anybody up there that could do it. Especially if you're going to someone that has physical therapy, don't go.
Yeah. Cleveland, we couldn't wait to get out of Cleveland. Really.
Very funny, Paul.
We're from there,
Wait a minute
that
now.
area originally.
Yeah. Don't forget, we both graduated from Ohio State, though.
Oh, wow. Now we got to find a... Well, the problem is there's only 2 people in the country that do this kind of work, and that's Paul, and that's the 2 Dr. P's.
I was hoping maybe he had something.
Well, you know what? Why don't you come down to Florida? It's a great place to come down.
He was here. He just left.
Oh,
I
okay.
yeah, I'm down there for about 7 months.
Yeah.
For the stormy season.
Sorry, Tony. Just
Okay.
know.
Or visit Arizona. Go see his son. Change your scenery.
Yeah. No, can't do that either. Thank you very much, Doctor.
All right,
Okay,
thanks for the
thank
call.
you.
I'll be seeing you.
See, we had to clone you. Put 52 of you out there. Well,
I
we got
could.
2.
If
we
somebody
need
wants to
50.
be trained, it's going to take about 6 months, and it's going to cost them a little time.
6 months. That's it.
Yeah. Well, if you know how to teach, you can
And
teach.
50
Yeah.
years later.
Okay, we ready for another? I got you both. We're gonna go to another. We're gonna go to another question, a short one because we have to take a break. Nancy from Tweeta asks, saw Leah was going to be given a boot for her injury, and you found the cause of her pain. I too am being fitted for a boot and have been told if I don't wear the boot, the pain in my foot will never go away. How long did it take Leah to get back to work, and what happened when she went to her doctor and told them she no longer has the pain?
Well, you have to ask Leah
Yeah.
that, but
I'd love to see
a boot should never be used. There's, in my opinion, there are several places in the body that should not have any restrictions. One is the hand and wrist. One is the foot and ankle, and the shoulder, and even the knee. But any of these joints should not be restricted in motion for any length of time. So a boot is out. A wrist protector is out. You don't want to do that because that causes more trouble than it cures.
And you know, they sell a lot of those wrist protectors.
I know they sell a lot of them, and they all cause trouble because the motion isn't there. So you start losing mobility, and that becomes a problem to treat.
Well, just
Paul has the same kind of impression, I'm sure.
you agree, Paul?
Yeah, I mean, of course, we're not talking a fracture.
No, we're not talking
Talking-
fracture.
Yeah, so we're just talking pain. Yeah, motion is, as the elder man says, motion is one of the key tenets of this field. Physical medicine.
Who's this
motion
elder man you're talking about?
Gee, dad and son getting into a little argument.
Hey, I look young today. I have my haircut.
Yeah, he actually looks really good today, Doc. So, Paul, you better be careful. I mean, here's what I always say when people say you're older. I says, I got there. You still have to make it there.
Oh, yeah.
My mother was 95, and she was always bemoaning, "Oh, I'm 95," and I said, "But everybody wants to be 95. You made it."
My father was 96, and I said to people, you're old. I said, yeah, but what's the alternative?
That's right. You're gonna get younger.
Paul, stay with us when we take a break, all right? We're going to be gone for about 90 seconds. Stay on the phone with us, okay? You got time?
Yeah.
Okay, we're going to take our first break. We have to.
And we'll be right back.
Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you or somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people people with living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon.
You're listening to Dr. Pannozzo's Sports and Medicine Hour with Dr. Anthony Pannozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pannozzo now at 1-800-889-0267 to get your pain issues resolved. Now, more of Dr. Pannozzo's Sports and Medicine Hour.
We be back. Okay, Paul and Doc, it's hard. Dr. Pannozzo up there, Dr. Pannozzo down here. We got another question. Let's see if what both of you think about this one. Let me get to another one. Okay. Russell from Survey Monkey writes in, I love playing tennis. It requires that you see your entire body to perform at your best. I played for years and trained hard at it. Now that I am older and cannot compete with many in the sport, I'd love to try reducing the pain in my body and the stress in that condition. I want to increase the areas of my body. I want my hands are constantly swollen from swinging the racket. Will that be an area that you can work on?
Of course, it's probably wrist. You'd know if it was elbow because you couldn't straighten your arm out, but it's probably wrist and or fingers. Everything is treatable if you want to go through it, and if you can't get it done, then you have to. I don't know what to tell you.
Well, Paul, what do you think? Oh, hold it before.
If there's an isolated place that hurts, a joint or at the wrist, then you can certainly go after it. Sometimes for generalized pain, I'm not going to shoot every joint and every finger. I like there's a topical Advil out there. Basically it's called Voltaren gel. You just rub it on there 4 times a day, and it's.
Hold it before you keep going. I've got someone that has a success story. Hold on, this is going to be very important for you to hear. Hi, you're on with the 2 Dr. Pannozzos.
Yes. Good morning.
Good morning.
I'd like to relate a life-changing episode as a result of Dr. Pannozzo.
Okay, great.
About 2 weeks ago, I started pain in my right knee, and it was getting worse. I couldn't straighten it out. I could hardly walk. Then my left, which I thought was my ankle, started, and I was in agony. I was going back north within 10 days. I didn't know what to do. I didn't want to have an operation. I've been listening to your show. So Monday, Memorial Day, I called the doctor's number. He answers the phone. Yes, Dr. Pannozzo answered the phone. I gave him a little history. He said, come in tomorrow at 10 o'clock. I says, well, he says, I'll take care of you. I got in the next day, Tuesday, and I could just about walk. I'm sitting down. My wife's filling out the papers. Some guy comes out of the back room, spins around, and says, I can dance again. And he walks out the office.
That was a patient.
I look at the patient next. I says, what's that? Oh, he says, he's the real deal. He says, I guess, I'm nervous.
Got another one. That's great.
So he looks at my papers. He says, he called me in. He knew I was in pain. I hobble in. We sat down. He went over everything with me. And I told him what. He grabbed my ankle, pressed down on my knee. I saw stars. I couldn't move.
Wow.
Get up on the table, turn over on your stomach. I said, can't. He says, turn over on your stomach. And he gently put me over, straightened out my knee a little, gave me a treatment, turned me on my side, gave me another treatment. Then he pulled up my shirt, gave me a treatment in the back, and he said, I'll be back in a few minutes. And he went and took care of another patient. Just sit there. I sat down. He came back in. He says, how you doing? I says, I don't know. He calls my wife over. He says, hey, look at that knee. The swelling's going down. This is in 10 minutes.
Wow.
He says, now I'd like you to step down. I said, I can't talk. He says, please, just step down. I stepped down. I put weight on the right foot. I put weight on the left foot. I don't say it was 100%, but it was 95% gone.
Pretty good.
Wow.
I didn't know what to say. He says, I'd like you to come back Thursday. This was Tuesday because you're going back within a couple of days, and I want to make sure you're lined up. He says, but if you don't want, I said, I'll come back. So I went back Thursday. He gave me 2 more treatments in my knee because that was very bad. And right now, today's Sunday. Yesterday, I was on my hands and knees washing the tile floor.
Wow. Wow.
That's amazing.
Wow.
Doctor, this is from my heart.
Oh, that's. Thank you. Thank you so
but,
much. I have somebody else that wants to thank.
What he didn't tell you, though, is he's blind.
Oh.
Really?
And he has a hard time
Getting around.
seeing, and so getting around is important for him.
Sure. Okay.
You're my doctor's doctor.
Thank you.
Okay.
Thank you.
We got another one. Hi, you're on with Dr. Pannozzo's.
Yeah. Hey, you guys, I have to go.
Oh,
Okay, Paul, have a good round there.
All right. I'll talk to you later.
Okay. Hi, you're on with one Dr. Pannozzo.
Yeah.
Hi.
Hey.
Yeah, you're on the air.
Hello.
Hello.
Hi, you're on with
Hello.
Dr. Pannozzo.
Hey, it's Jimmy.
Hey, Jimmy.
Hey, Jimmy, how you doing?
I'm doing well. I just called to tell him thanks for what he did for me. I do got to come back, but for another unrelated issue. But
And how you doing, Jimmy?
I'm doing well, buddy. I'm doing real well.
We you know what? It's amazing. I like when people call up because a lot of people don't think that what we're saying is real.
I asked people called in. If
Yes,
they,
please.
Either way, if they got benefit or not.
If you don't have
because,
benefit, call up,
you
right?
know, when you
And they do. I mean, most people, I've known you guys a while now, but you guys, I had an accident in '95, and nobody could help me. I went down there, and he straightened out my neck pretty good, and got to go back and see him again. But, I got to say, nobody else could do what he did for me. You figure from '95 till this year, it was this year, I believe it was, I went and saw him. Yes, it was.
Mm-hmm.
And, I don't see any problems with what he does. He does a hell of a deal for me.
Wow, that's me. Thank you so much, my friend.
And I know he did for Freddy, and he did for Leah, and I believe you went in and
Oh
saw
yeah,
him.
I went in 2 shots. Two
Yeah,
shots.
and so, we've all been in to see him, and you just got to go there. And if you don't want to go, I guess you don't go, but you're missing out.
You don't go. It's foolish. Why why have pain?
thanks, Jimmy.
Well, Jamie, thank you so much
Appreciate
for
for
calling.
you
All
calling.
right, we'll
Jim.
talk to you guys.
Thanks,
All right,
buddy.
man. See you in a little
Yes,
bit.
sir.
Hi, you're on with Dr. Pannozzo. Hello.
Yes, you're on the air.
Hi, you're on with Dr. Pannozzo.
Dr. Pannozzo, this is Jeff. I came down to see you a couple of weeks ago, and I want to say thank you.
Oh man,
You worked on my elbow and my shoulder and my right arm. I'm still a little tense in the ligaments in the right elbow. However, the shoulder, as I've been telling my neighbors, gradually went from I feel better to I feel great to amazing what this guy did for me in one visit. I have more range of motion and no pain in my shoulder for the first time in 12 years.
Wow.
And I have not fainted since I left your office.
And was it a painful process? And be honest.
Well,
I didn't hear the question.
Go ahead.
Was it a painful process?
No, I just have I have this thing about needles. I just don't like them. I don't like.
that's a
I don't like going to
vagal
my
reflex.
body. So the almost fainting part was like a natural reaction when I give blood or
Yeah.
anything like that. But the elbow almost like within 10 minutes after the shock, felt great. And then, like I said, the shoulder, 12 years since I've had this much range of motion.
Wow.
Unbelievable.
And no pain. I don't fall. My arm doesn't fall asleep anymore when I go to sleep at night. I'm not waking up every couple hours trying to shake out the blood circulation.
Did I do all this in one visit?
You did.
It's pretty good, Doc.
You actually. I'm looking forward to seeing you again for the other shoulder.
Excellent.
Now that this part of my body is not hurting anymore, I'm starting to feel the pains in the other parts of the body. That are like, okay, if you could do this with one shoulder visit and one arm, I can't wait to come back and see you.
Well, it's funny. I had the same thing with me when I went to see him. That's very funny.
Yeah. The thing is, I have neighbors that like I very rarely see, but since they knew I went to him, they're now like coming by more often to see me. How's this going? I'm like,
very funny.
It's like they're still going to physical therapy to other doctors and shots and pills and painkillers, and I'm like, man, I was in that office for like an hour. And I'm just like, I'm wonderful right now.
That's I shouldn't say amazing. It's real. We all know
It's not amazing. It's just a science.
It's a science about what he does.
Exactly. I mean, I've had too many doctors over the last 20 years talk about surgery and pain pills and prescriptions. And I had nothing done until I started listening to his show a few months ago. And now it's just like, I had to call. I missed you last week because I was driving. I didn't get the phone number in time, and your show went off the air.
561-381-5800, his personal phone call.
Thanks a lot for calling.
Oh, no, I've got to stack his cards I'm handing out to all my neighbors.
We appreciate that. Thank you for calling and sharing your story.
Oh, that means a lot to us. I love when people call up. Again, we always say if you had a problem, call up too. We want to handle everything that you have.
Yeah, you just have to give out that 800 number for the radio show more often.
You're right. I'm going to give it out right now. I appreciate you saying that. I get so wrapped up in what we're talking about that I forget. It's 1-800-889-0267. Freddie, what's the number?
800-889-0267.
Colleen, what's the number? She doesn't know it. Okay.
Well,
Thank you so
y'all
much.
have a great week. And again, Dr. Pannozzo, thank you. I'll probably be coming to see you in a couple of weeks again.
All right, thanks for the call. Appreciate it.
We really do.
Got to deal with the other side, and I'm sure a lot of my neighbors are going to make the trek down to Delray.
All right.
Definitely worth the trip.
I keep telling them it is.
It is.
It is
Yeah.
worth it, right?
Yeah. And like I said, the fact that they're like coming by my house to see me more often to see how I'm doing, I think they're convinced now too.
Well, you're healed and they're still in pain.
Yeah. Yeah, exactly.
Comes down to-
A lot of people are traveling hours and hours to get to me, but
So it's worth it.
and
Well, I
it is
actually
worth
sat in
it.
your office and I met a gentleman who drove all the way down from Jupiter.
Yeah, well, that's common. Yeah,
Yeah.
I drove all the way from Fort Lauderdale.
Vero Beach, Jupiter, West Palm Beach.
I could have been in New York.
Tallahassee. Tallahassee. Could you imagine what a drive
I
that
could
is?
have been in New York with the pain I had in my leg, and I would have driven down here to see you. God's honest truth.
Oh, I got to, I thank everybody, but I have someone on the line that wants to ask Dr. Pannozzo a question. Thank you so much
I'm
for
going to
calling.
let y'all go. You take care. I want to listen to the rest of the show. You have a great week.
Thank you, my friend. Hi there. You have a question for Dr. Pannozzo?
Yes, my name is David. How are you?
Hi, David. How are you?
Good. In 1999, I was in a very severe car accident where my femur was crushed, and I have a femur rod in. And about 4 or 5 months ago, I started getting this pain in my right foot, which is the same leg where the femur rod is. They never took it out. And it's weird. I don't know what it is. I thought it was psoriatic arthritis. I thought it was, somebody said, "Oh, are you diabetic?" And I'm not. And it comes and goes, but it certainly affects my walking and my mobility.
Well, is your foot swollen? I mean,
I'm sorry, sir?
is your foot swollen?
No, you know what's really weird, though? It's not swollen, but when I look at my toes on my left foot and my right foot, like the toes are more separated on the right foot. They don't look even. And that's something that I noticed.
I don't know. Would that have to be put together? But how's that knee?
The knee and the femur are fine.
Okay. How's your back?
My back is fine. It's just, like I said, the last 5 or 6 months, doctor, I've had this excruciating pain in my right foot.
Well, which part of your foot? Which part? The toes or the ankle part?
Between the toes and the ball of the foot, sir.
Oh, well, that's probably a local then.
It's probably what?
It's probably a local one of the joints in there. Those are treatable.
All right. So I will definitely call tomorrow and make an appointment, and I thank you for your time.
Oh, sure.
Oh,
no
so
problem.
we
No,
almost
thank
have
you.
time. Oh, let me give you that number so you'll have it. It's 561-381-5800, and believe me, it's worth it. I'm a patient.
I definitely, well, I'm not calling for free advice. I'm definitely going to call and make an appointment, and because it's been excruciating for the last, like I said, 5 months or so, and
No,
I
that's
was
too long.
worried. Somebody's like, "Oh, you have diabetic nerve pain," and I'm like, "No, my sugars are fine, my
No.
cholesterol's fine, my weight is fine."
Diabetic nerve pain doesn't happen.
That's what see.
You went into my arch when you took care of my foot, which removed the pain in the back of the leg completely. So maybe he has something like that going on with him.
No,
You
it's
gotta check.
it's a joint. It's called a metatarsal phalangeal joint is what he's describing. I think.
Oh, okay.
I completely forgot to mention this. About 3 years ago, I had an open fracture in my big toe. I dropped an armoire on it and bled for about 5 hours before I went to the emergency room. And I'm wondering if that has anything to do with it. I just thought of that now.
Well, it's possible. We're just examined for it. That's all. I mean, whatever's wrong is going to show if you know how to find it. And yeah, we will. Yeah, just make an appointment. You'll be all right.
I thank you so much for your time,
You're
sir.
welcome.
And thank you so much for calling. And believe me, when you go to see him, you're not going to have any more pain.
All righty, I'm looking
Don't
forward
promise
to it.
things.
No, well,
He's going to guarantee it.
You're going to limp in, and you're going to.
Les is going to guarantee. You
I'm
don't
going to
have any
guarantee
pain.
it because Les had a pain in his groin, which is worse than a pain in your neck. And one shot, and Les was walking and jumping and working out at the gym. So that's all I can say. Thank you so
Thank
much for
you,
your
gentlemen.
call. Let's see, we got another call in today. Okay, let's see. What do I got here today? Okay, another one, Doc.
800-889-0267. Bring him on.
Okay, Sarah from Survey Monkey asks, how young are the children you have worked with in the past, and did they grow up and lead a normal life? These are children that had scoliosis. My son is 6 and seems to have a traditional lump on his back, as doctors tell me he will grow out of that. But I'm not too sure they know what they're talking about.
They don't.
They don't. That's
And
exactly right.
the treatment for this is very simple. It's just ultrasound. That's all.
Right.
And that'll come right out. The younger you are, the easier it is to treat these things, and they do come to normal. You see, you have to understand there's something holding it in a crooked position.
Right.
Okay, once you know what that is and you know how to find it, the treatment's easy.
Right.
There's nothing to it. That's why there should be no surgery for scoliosis at all, ever again.
And that's coming from someone who has done what the doctors say can't be done. And you can always go to Pannozzo, that's P-A-N-N-O.
But see, we have the advantage because we have a C-arm with the fluoroscope,
Right.
and you can see before and after. The advantage of a fluoroscope is that it stores an image. It's not like a regular X-ray. It is an X-ray, but a regular X-ray you need to process the film and then look at it. But on the fluoroscope, you can store the image that you see, and then you could do another one, and then you compare those things, and you can actually see the turn. So when I tell you that we actually treat this and reduce the curvature, I know what I'm talking about. You got to see it for yourself. It's just amazing stuff.
Well, they could go to Pannozzo.tv. That's Pannozzo.tv.
There was an insurance company who wants to put in place what you can do to their clients.
Mm-hmm.
And,
You mean they don't want you to cure them?
well, I don't know what you mean.
That's a good question.
I mean, who are these people who are going to tell you what to do?
Don't cure them.
I mean, hey, you know what? If they know more than I do, then you get them. I'll refer them all to you.
Well, why should an insurance company
But there's
tell
no one
people
in
what
the
to do?
world knows as much of musculoskeletal that I do, and
Right.
I can guarantee that. And so you got to be careful what's going on in the insurance world. The less they approve, the more money they keep of yours, which is, well, look what happened to Humana now. They're going to be bought out for over $200 a share.
Wow.
That never passed $30 until Obama.
Obamacare.
Yeah.
And now they put in these policies that your copay is huge, your deductibles are huge, and they're not spending your money. That's your money that they have.
That's exactly right.
So, and Blue Cross Blue Shield is going to do the same thing, and you've got to stay away from those companies.
Well, the bottom line is, how could an insurance company dictate what you know or any doctor knows?
Well, they're not in the room with you.
That's exactly
How are
right.
they supposed to know?
Right.
They can't know.
I mean,
There's just no way they can know.
To me, I don't think there's anything worse than pain. I mean, I'm looking at you, Freddie, who couldn't even carry a bag. Now you're carrying 200 pounds of equipment.
That's right.
Did you care if you had insurance or not?
No.
No.
Are you kidding? I was miserable.
Well, I live with pain.
It's like the guys that call in. They were miserable for 4 years.
Well, the problem here is when you don't have insurance or it doesn't cover, you're better off in my office because we have an X number of dollars that you're going to spend, and that's it. Mm-hmm. It's not forever. It's not test after test. It's you get it, done. And that's what you're hearing on the radio when people call in. More people should call in because we do this every day, magnificent results, and you can't get people to call in to tell you those things.
Well, I'm glad they...
That's because Les doesn't give the number out enough.
1-800-889-0267.
That's what it is. People tell me this all the time.
But that description that fella said about the waiting room,
right?
That happens almost every time somebody comes out of there. They just...
But think about it, Doc. I waited 4 years for you to fix me.
Yeah.
I can wait 1 more hour. Come on, give me a break.
You didn't wait in my office 4 years.
No.
That's what I'm saying. I waited 4 years to meet you.
Well, somebody might misconstrue what you just said.
4 years I waited to meet you.
Okay.
Yeah.
Before you saw me, yeah.
Yeah, I mean, the bottom line is...
Waiting an hour is nothing.
I always tell people, you go to your doctor, any doctor, and the first thing you do is they fill out all those papers, and then they sit, and you have that nice big room with the TV on. Then an hour later, they bring you into this little room where it's nice and cold, and you're sitting on this thing with the paper. Okay, girl comes in and says, I got to take your blood, this and that.
Think about you have to worry about on these days where jobs are not that plentiful, your money's short. You want to go where you get taken care of quickly. If whatever's wrong with you, you want it done right now, and you want it quick,
right,
and without extra cost in the future. And we could do that. But don't let the insurance company tell you what to do. I mean, if they don't approve something, hey, that's too bad. It's still your body. You got to take care of yourself.
But Doc, nobody does what you do.
Nobody.
And that's the point. And I think that people are going to start to call because
they do now.
His neighbors are beginning to see, well, I'm still taking pills. I'm going back. That adds up. You can go to see a doctor 100 times. That adds up. To go see you maybe once or twice. You're done.
Yeah, that's
moving on to new pain.
We try to do it real fast, like that fella was talking about the knee and the back. We could do a lot of work on someone if we have a goal. You got to be out of town in 5 days. Yeah, we can fix this up. I mean, we just do it.
I mean, you cured that lady's scoliosis. She was here 6 months, right?
No.
3 months?
3 weeks, I think.
3 weeks. Oh. It was a 3-something. But she walked around there for 72 years.
Yeah.
You know what it is people can't believe what you could do.
Yeah.
But I hope the people that called in, a lot of you listeners that are listening out there, it's real. I mean, this is real stuff. I mean, I walked. Freddie, I walked around with groin pain, and when you're lifting weights and you're doing cardio stuff, you can't do it with groin pain. And you want to know something? The needle. I think the alcohol he put on hurt more than the needle.
Well, you heard the guy was more scared than you on the needles, and he said,
the bodybuilder.
Yeah.
Well, one thing about you describing the shots are placed where the problem originates. They're just not done haphazardly. Everything's recorded, left, right, up and down, whatever the numbers are recorded in that record. So when if you have to come back, then we already know what we've done. We look for other places. Each shot we do is a cure in itself because it goes to the source of that pain. How do I know that? Well, because you lose your pain in 2 minutes, 3 minutes. That's why.
And what that other
And
guy
it doesn't come back. So once you lose that pain in the office there, we know we're in the right spot. And you understand the cause and effect. You do this, you get this. You do that, you get that. This is how we think. And if we do this to you, we fully expect you to have normal range of motion. See? We expect that. If not, we don't let you leave the office.
Right.
So we take care of that thing. We take care of business, as they say.
Taking care of business at Dr. Pannozzo. Okay? So it's coming towards the end of the show, so let me give you the number that you could call Dr. Pannozzo. And now, Dr. Pannozzo is driving today, so let me say this. Please call up at 12:30, 561-381-5800, because I need Dr. Pannozzo alive, and I have to be alive. So please, call up at 12:30, 561-381-5800. And anybody out there that doubts us, please come on in.
16244 South Military Trail, number 740 in Delray Beach, across the street from
Walmart. So after you see Dr. Pannozzo with your pain, you could go shopping at Walmart.
That's right.
I saw him on a Tuesday. I was out golfing Wednesday.
Yep. That's what I expect.
Yeah.
We expect this.
And you won't understand what he does by us talking unless you're coming.
Okay.
All you can do is come on in, sit in the office, and just talk to the people there.
Oh, you heard that guy say the guy came out dancing.
Yeah, no, I was there when there was a golfer there who hadn't played in golf. He heard it from Leah, heard the show, and said, "What the heck? I'm going to call him up." I was there when he was coming back for something other than the golf thing. I said, "How you doing?" He said, "I played golf the next day." I said, "How'd you play?" He said, "I didn't really play well because I hadn't played golf for quite a while until I saw this man."
But now I'm playing again.
Yeah, and that's so. All you golfers,
Excellent.
anyone that has pain, I say to all the golfers, stop trying to fix your swing. You know the art of golf. Now get the physiology of golf.
Yeah, the art of golf you learn from
the instructor,
PGA instructor.
Right.
They don't know the physiology of the swing. I would tell you that right now, and they should admit it. They do not know.
Okay, Colleen's looking at me like you better get off because I'm going to yell at you.
1 minute.
561-381-5800. Thank you for all the people that called in that have been treated by Dr. Pannozzo, and we'll see you next week.
Thanks. Bye.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.
News, traffic, weather, every 10 minutes from 6 a.m.